complex intervention, that is chronic total occlusions. We have invited three renowned speakers, the CTO operators from Japan. You know, Japan is the country who innovated CTO, particularly the retrograde interventions. May I first call upon Dr. Kashima to discuss selecting the appropriate hardware in CTO interventions. Over to you, Dr. Kashima.
Hello, I'm Yoshifumi Kashima. How are you in COVID-19 situation? I hope we will work together face to face after overcoming COVID-19. First of all, I'm very glad to have an opportunity to share you my presentation in this conference. Thank you very much, my friends in Sri Lanka. I have only 15 minutes today, so I will focus on the anti-grade guide wire selection. CTO is one of the unresolved regions and the essential problem is invisible. There are only 4 pathways to make our CTO wiring in invisible CTO regions. Those are anti-grade 2 tracking, anti-grade subintimal tracking, retrograde 2 tracking, and retrograde subintimal tracking. As you know, this is a global CTO crossing algorithm. Looks like a little bit complicated cascade. However, if we pick up only the actual procedure, it becomes very simple, as shown in the figure on the right. The reason for this is that we have only 4 pathways and a few strategies. The reason why many operators prefer the retrograde approach in recent CTO procedure is probably because the reverse cut concept works very well, whether it is 2 tracking or subintimal tracking in retrograde approach. On the other hand, we don't have any reliable method to get distal to lumen with the anti-grade subintimal tracking, even if using the parallel wiring, IRIS guidance wiring, and ADR. Therefore, the anti-grade 2 tracking is very important to have the good procedure success rate because the interventional collateral is not always available there. This slide shows the guide wire and the strategy history in the CTO field. As you know, the guide wires and the treatment strategies of CTO have evolved to influence each other. Until the early 2000s, only the anti-grade approach was used, but since then, the retrograde approach has been added to the treatment strategy, which has greatly contributed to the improvement of the procedure success rate. On the other hand, after unsuccessful bidirectional approach, it has also been reported that the success rate is greatly influenced by the technical skill of the subsequent anti-grade approach and the level of the operator skill. In other words, improving the technical skills of anti-grade wiring is the key to overcoming the remaining challenges of CTO intervention. And the wire selection is very important in this process. In order to make an appropriate guide wire selection, it is first necessary to recognize what you want to do with that guide wire. In anti-glare true tracking, what we need to do is actually quite simple. Whatever the region morphology, as the proximal cap and the distal cap, we perform penetration with the guide wire. The CTO value, depending on the region condition, either navigation with direction and deflection control, drilling, or a combination of both will be selected. This slide shows the CTO guide wire library, which are available in Japan. There are a lot of CTO guide wires, despite the fact that we only have a few different wire manipulation methods. This means that we need to fully understand the characteristics of guide wires and choose the appropriate wire for the situation. I will now show the must-have wire characteristics for selecting a CTO guide wire. First, I will explain the relationship between penetration force and the tip design. Even after more than 30 years of PCI, many operators still think that penetration force and tip load are the same. This may be due to the fact that the guide wire itself is extremely thin, making it difficult to notice the difference in the tip design. So I will show you a magnified view of the guide wire tip to make it easier to understand for you. Then you may notice that there are very different tip designs. Since the penetration force is the tip load per unit area, the penetration force of Neo 3 with a ground chip is smaller than that of UB3 or Gladius with a ball chip, even with the same tip load of 3 grams. Although the tip load of the Gaia family is not high, the penetration force is extremely large because of the microcon tip. Therefore, you may understand that not only the tip load, but also tip design has a great impact on the penetration force. The left image shows the Gaia Next one with a regular microcon chip, and the right image shows the Gaia Next one with a ball chip. They used for experiments on penetration of the proximal cap. Again, both are the same Gaia Next one, except for the tip design. The normal Gaia Next one on the left makes the penetration cap by deflection. On the other hand, the Gaia Next one on the right, with only the wire tip as a ball chip, does not penetrate the cap, but rather slips on the surface on the cap. As you can see, tip design alone has a big impact on the wire manipulation of penetration. Therefore, when considering the penetration effect, the wire selection should include not only the tip load but also tip design. Next, I'm talking about the wire lubricity. Everybody knows that polymer jacket wire has the highest lubricity performance. So, do you even know how that lubricity affects our wire manipulations? Please watch the video on the left and center at first. We are examining the difference in effect between XTA with polymer jacket coating and XTA with non-coating on the abrupt and smooth proximal cap. The XTA we use in daily PCI, which has a polymer jacket, cannot penetrate the proximal cap in this condition, but only slips on the surface of the cap. The non-coating XTA made for this test is able to penetrate the cap without slipping on the surface, although it is difficult to do so. Please see the video on the right. Even XTA with a polymer jacket can penetrate the proximal cap if the cap surface is in rough conditions. From these experiments, we can understand that polymer jacket wire is basically unsuitable for the wire manipulation of penetration due to the rubbericity. Next, I will show you how rubbericity affects wire manipulation in the CTO body. The left image shows the Gaia Next 2 with hydrophilic coating, and the right image shows the Gaia Next 2 without any coating. The Gaia Next 2 we use in daily PCI, which has a hydrophilic coating, can be manipulated with direction and deflection control in CTO body. On the other hand, Gaia Next 2 without coating becomes difficult to operate and stack due to the frictional resistance inside the CTO body. Thus, the rubbericity has a significant effect in the CTO body where frictional resistance is high and is important for good wire manipulation. In this model, each guide wire will be tested to see if it can penetrate the 0.3 mm hard paraffin cap beyond the two bends filled with a material hardness similar to the CTO body just after bifurcation. When Conquest Pro 12 passes through the bifurcation site, then it cannot follow the subsequent bends and cannot even reach the cap. The Gaia Next 3 and 4 have X-strand coils, therefore they can easily follow this complex CTO body. However, the Gaia Next 3 cannot penetrate the hard paraffin cap and finally makes prolapse on the bifurcation site. The Gaia Next 4 in particular has a high-spec X-strand coil which can easily follow the complex CTO body, which require complicated wire manipulation and if even after that, can easily penetrate the distal cap. Gaia Next 4 is structurally different from the previous Gaia Next series, with the largest core wire made of pure platinum coils. And a very important part, the X-strand coil, which has the largest diameter and a different material composition. In mechanical wires, it is extremely difficult to achieve both strong penetration force and flexible controllability, but the improved X-strand coil of the Gaia Next 4 achieves this trade-off at a high level. The Gaia Next 4 has the same strong penetration force as the Conquest Pro 12, while enabling the best feature of the Gaia family, deflection control. I will share you my guide wire selection for my CTO procedures. This chart was created based on the characteristics of the wire and the region morphology to which it can be adapted. Therefore, you can basically choose the best wire for each phase and each case in your CTO procedure from this chart. The greatest advantage of human is to full use tools, and the greatest ability of human is our deep thinking. I mean, it is impossible for an operator who does not understand the device characteristics and the premise knowledge to develop the best treatment strategy, including device selections, especially in visible CTO regions. Thank you for your attention.
Thank you very much, Dr. Yoshifumi Kashima, for your excellent talk, giving us excellent overview of different types of guide wires you can use in CTO. So in this symposium,